Hello there. My name is Peter Schultz. I'm a dosimetrist from Denmark, and I work at the Department of Oncology at Aarhus University Hospital. I'm specialized in dose planning breasts, and today I'll attempt to show you my technique for field-in-field dose planning of these. Thomas has asked me to show you what I can do, and I hope that it could be useful for you. I will demonstrate on a left-sided breast cancer which got a lobectomy with disease spreading to the axillary lymph nodes. So I will radiate the breast, the parasternal lymph nodes, and the axillary lymph nodes, apart from level 1, as she has only spreading to 5 or less lymph nodes, so we do not attempt to cover level 1, but it might turn out to be in the beam anyway, but we don't attempt to cover it with those. Now, this patient I've selected is actually originally a bilateral breast cancer, which you cannot tell from here. So you'll notice that the MLCs are fit very, very close to the PTV edge here, and the same a bit further down along the breast, the heart, sorry. But it will also it'll make it more obvious why some of the things I do work very well. And what we do is we plan it with a half beam technique. So we have by the isocenter we have the tangents fields for the breast, and then the APPA fields for the axillary lymph nodes, and a little part of the upper part of the breast. And as you can see, we have drawn in the humeral head and the tracheal throat so that we can avoid them when we set up the fields. Anyway, I will simply start out by beginning to set up my my fields here. I have already cheated a bit and put on mixed beam, so it's half and half basically of high and low energy, actually a bit more high energy than low. So what I usually do is I put some dose on the axillary area. I put a amount of dose in, and then I begin working on the breast. And right now this one has a bit of a problem right here, which is going to give us problems later on, I believe, with the hotspot right here in the edge of the breast, because you'll see. So what I usually do is I put a bit more dose on the medial side of the breast than on the lateral side, because I want to have as much dose as possible for the parasternal lymph nodes. So this is field 2. I'm just gonna increase it just a bit here, 75 and 0.4. Okay. Anyway, so I have a little bit of overweight of dose on the medial side and a little less on the lateral side. So then I start out by setting on fields from the lateral side, but also from the medial side, but first off from the lateral side. Good. Now I'm just going to switch off all the structures and put my dose to 95. I always use my fields with DRRs on because it gives a better contrast in the picture. So I always have a DRR, so I have the patient visible here. Now what I do is to know where of course you can see here on the color wash where it's where you probably have to put the MLCs. But what I usually do is I set the slider over here on the side to, when it's AAA, I set it to about 3% around there below maximum, and then I put on my my intensity modulating field, my IM field here. There you go. And I make them as small as possible. Right. So let's go back and check if it looks like I want it to. This is good. So I'm going to put some dose on and calculate. Right. So I'm going to go back and see how it looks. What I'm supposed to happen is it's supposed to stay hot in the entire area. It has to look a bit more similar. So if I go to 107%, it should look like one big blob of dose, and it does that. It looks actually pretty nice. So hurrah. It seems to me when I go back here and look at the fields that it would be a good idea to put in a field from the medial side. Let's see. Yeah, because of the divergence. So I'm going to put on a field from the medial side. Yes. And again, 95, and then the slider up to around 107%. Okay, so here comes the first part where it might be a bit tricky, because I'll set the field along the edge here of the dose color wash. There we go. And fix all this. Okay. And now I'm going to go back and check if it looks good in beamside view. I think this is okay. What I'm looking for is that it doesn't get too cold around where it's going into the patient. I shouldn't be creating too much of this you see right here where it gets a bit colder. Because if a plan has to be sort of even and robust, it doesn't fit too well that you make too many places where the dose doesn't overlap correctly. Now, let's take a look here. Okay. Well, this isn't bad. This is actually pretty good. So I'm going to go over and check if my field looks like I want it to. And this is, again, around 3% under. This is a AAA thing with the 3%. And if you find something you feel that works better, then do that. But it seems as if it's doing what I wanted to. I'm going to put a field on from the lateral side now. And always I do these IM segments with very low amount of Mounds units, and then I do a lot of them because of the field technique. It doesn't matter too much as long as the rule in our house is 5 Mounds units minimum per IM segment. That's dosimetrically sound. Our physicists tell me. So that's what I follow. So number 2 IM segment from the lateral side. I'm going to check here if it fits. Oop, that's not going to be good. So you see what I'm trying to get at here. What 105 is that down here it sort of goes right on the back side of where it's warm, but here it moves out of it. So this is probably up here, and this is where it tricks the beams of view tricks you. So I'm gonna go down and correct this. Yeah, I like this better. Let's see if yeah. So you get this small movement here. Maybe I'm just gonna do like that, and put some dose on it, and calculate. Yeah. And now it's getting warm at this point, but I'm not going to change. I'm going to worry too much about that right now. I'm simply just going to go on and put field number 1.4 on, and then go back and correct them afterwards. And what I do a lot of small corrections while I do the plan. I try to keep the plan very sound in its evenness, if you can say that. It's probably not a good way of saying it, but I sort of try to keep it very even all the way through, because then when I'm done, it helps me to be able to not get too high a dose max in a very even plan. I don't get holes in my dose. So I'm just going to put dose on this one too. Let's see if it's over there. Okay. Let's see. Not bad. So now if I go to around 3% under, I shouldn't get two holes too large in dose. Okay, so we have over here on the edge of the breast already. It's giving a small problem, so I'm just going to put some dose on the main field 1 here. 0.45. Just put a little bit of extra weight on it. Yeah, it helped a bit. And then maybe I'm just going to change, I'm just going to correct field number 1.2, sorry. I'm just going to correct this. And hopefully we can put on another segment. Let's see. Yeah. This is good. And now I regret putting some dose on the medial, on the lateral side. I'm just going to change it again. That's how it is. There's always all these small little modifications. So I'm going to put another medial field on now. And another lateral field. Now I can't tell which one I'm going to do first. I'm probably going to do the lateral field. There we go. So what I do is I simply just keep on loading up with fields here until I get good coverage. So what I'm doing, I usually say to myself that I'm sort of splitting it up into phases. So there's the dose coverage phase where I attempt to get the coverage as good as possible, and when I've succeeded that I can cover it, then I'll try to even out the dose. Now we're gonna get some problems here on the medial side where it's getting a bit hot, so I'm actually going to begin to simply cover it over here from the lateral side, not from the medial side, because that will give me problems later when I have to cover the parasternal lymph nodes. Oh, yep. All right. Hopefully it's done as I thought. Let's see. Yeah. That's not too bad actually. So now I have field 2, 3. I'm just gonna move the slider here and see. It's supposed to go into covering this area here. So I better enlarge it. and then put on the dose here. And here comes an interesting point in the plan. This is here where I actually make it as a split field, because it's warm right here along the edge of the chest wall. So now I'm going to first make the field where I cover this area here, and afterwards I will make the field where I put it on the other side. So I split it. I put those in on this side, and later in field number 2, 5 or something, I'm going to cover the lymph nodes on the inside. So they're going to be different. Split field. I'm just going to check if this looks good on 102, I guess it's supposed to look at. Yeah, not bad. Okay, I'm going to put some dose on, 0.05. Yes, just going to save this. Okay. Oh yes, I like this. Now, just to make it a bit more difficult for myself, the dose this patient is getting is 40 on 15 fractions, 40 gray on 50 fractions. So our Dmax, if we can, is 105, and a bit of it can be up to 107. Because if it's 50 on 25 fractions, our Dmax can be up to 107. So this is going to be a bit more difficult for me. I don't have a really great coverage yet, but it's looking good. You see, we're still missing a bit in this area here. Now I can choose to put some more mixed beam on if I like that, but actually you can see the dose right here. I'm just going to switch off the fields. The dose is already, the build-up zone is pretty long already. So what I'm going to do is I'm going to put on a field that goes from the back side here and up and covers this. So basically the same angle as the axillary field from the backside, but maybe a bit different. It doesn't matter. And this is going to be field 5.0. Yes, yes. And I usually and this works very well, this field here. Maybe 170. It has to be a bit steep to go around the hotspots. So I'm just going to check where will it fit in. This isn't bad actually. This is a good angle. So I go over and switch off all my structures so I can't see nothing. And again, I move the slider until it shows me the cold area. Now this is a bit difficult because it's actually warm on the front side too, so you can't really see it, but I know that it's along the chest wall and a bit in front of it. So I take this field, I draw to there it looks cold and around the chest wall and up. Yoinks. And we'll just set the jaws so that it looks, so they're not too big. There we go. Go back and check if it's been put into the correct area. And lo and behold, it doesn't look that bad. Maybe it's a bit too open, so I'm just going to narrow it down a bit because it was just a guess. I'm just going to narrow it down just a little bit there, and maybe just a little bit from the. Now I can also put FieldinField on this field from the backside, and I don't need to cover everything with it. It's okay that it just covers the middle of the blue area, because it will put my Dmax down. You can see it's 105.2, and when I put some dose on it, you'll notice it will fall. See, it fell just a little bit, 104.8, and it's probably a little bit better coverage in the middle. I can try to show it. Point dose here, 96.7. I'm just going to switch it off the field, 95.5, and a lower and a higher Dmax. So not bad. 1.2%. That's actually a bit. with a lower Dmax. So now it's getting a bit warm out here in the front, and that's why I use low energy. Because if you use high energy, it's going to put too much dose up here. So so there will be a little bit of dose in the flank, but I mean, it's really nothing. It really isn't. I mean, look at how little it is. This is 3.7% out of 10 percent. Our doctors don't believe that's such a big problem. Okay, so I might put another segment on this field 5, but right now I'm going to return to my main fields and look if this. I still need to get some dose put into this area right here. So I'm going to look to how this is possible. Oh yeah, another detail about this field from the backside is that I attempt to make it as far out of the lung as possible. So if you look at here at the just 50% dose, and you'll see it's not actually moving that outside or that far outside where there's already a lot of dose. So I'm not really giving the lung much dose. Sometimes I actually make it a bit bigger. I'm just going to try to do that to see what happens. So I'm going to move it in there. There, see, I moved it a bit in on the lung. Yeah. And it gives me a little bit better coverage. Now I'm going to look right now if it's the next field is supposed to be from the lateral or the medial side. It seems to me that I probably have to put some dose in from the lateral side to get it in here, because this isn't warm enough. It ain't warm enough. I'm just going to put some dose on there. And back to beam side view. And I'm going to move the slider to find where it's possible to put some dose in. Oh, it's getting narrow. There's not much space to put in a lot of dose. Now, if you notice that the front side of the breast is, I'm pulling some dose away, maybe too much dose away from it. So I might have to go back and correct that. But that's how it is. Okay, so this is my guess of where I can put dose in. So I'm going to double check. It's possible where field 5 is gone. Now this isn't bad. I'm going to check if it works out. And now I'm going to go back and adjust all the fields, just to make sure that things are evened out before I try to finish the plan. And this also goes for the axillary fields, because it becomes a problem later if you do not keep it up to date, so that there's enough dose that's spread down into the other field. So I keep the dose max up here, or not dose max, but enough dose up here, so that when I finish my tendons, it doesn't change anything. So I'm going to, the next stage, I'm going to even out the dose, and then I'm going to do finish up my split fields for the peristernal lymph nodes. So that'll be in the next video. I'm going to stop this video right now, and I'll see you in the next video.